Right now, as you watch this video, there are millions of people over the age of 60 taking a blood pressure medication every single morning, a pill they were told they would need for the rest of their lives. And here is what their doctors haven't told them. For a significant portion of those patients, that pill is not only failing to address the root cause of their hypertension, it may be actively depleting the very nutrients their aging cardiovascular system needs most. I know that sounds alarming. I know it challenges everything you've been told. But after 31 years of clinical practice, and after spending a decade studying the intersection of Western cardiology and traditional Chinese medicine, I can no longer stay silent about what I see happening to my patients over 60. My name is Dr. Ming Chen. I'm a board-certified internist with a subspecialty focus on cardiovascular health in older adults, and I've been practicing medicine for over 3 decades. In that time, I have watched the pharmaceutical paradigm for blood pressure management become increasingly one-size-fits-all, particularly for patients in their 60s, 70s, and 80s whose physiology, hormonal landscape, and vascular biology are fundamentally different from a 40-year-old's. And I've spent the last 10 years integrating what traditional Chinese medicine calls the root and branch model of hypertension into my clinical practice. What I want to share with you today is not a rejection of modern medicine. It is something more nuanced and far more powerful. A way of thinking about blood pressure that could genuinely change your health trajectory after 60. Think of your cardiovascular system like the plumbing in a very old house. When you moved in, let's say at age 30, the pipes were clean, flexible, elastic. Water flowed easily. But over decades, mineral deposits build up, the pipes stiffen, and the pump, your heart, has to work harder to push water through. Now, what most blood pressure medications do is essentially turn down the pump. They reduce the pressure by slowing the heart, dilating the vessels, or removing fluid. That is the branch. It addresses the symptom. But what traditional Chinese medicine has always asked, and what modern functional cardiology is now beginning to validate, is why did the pipes stiffen in the first place? And what can we do to address that underlying process? That is the root. And today I am going to give you 4 fundamental insights from this integrated approach that I believe every person over 60 deserves to know. Let me start with something that will surprise you. The most commonly prescribed class of blood pressure medications for older adults, calcium channel blockers like amlodipine, beta blockers like metoprolol, and ACE inhibitors, each have documented effects on micronutrient status that are rarely discussed in a 15-minute office visit. A study published in the Journal of the American College of Cardiology, conducted by researchers at Johns Hopkins, found that long-term use of certain antihypertensive medications was associated with measurable depletion of coenzyme Q10, magnesium, and zinc, 3 nutrients that are not coincidentally central to healthy vascular function and cardiac energy production. In older adults where baseline nutritional status is already frequently compromised, this depletion can create what I call a pharmacological trap. The medication lowers blood pressure numbers, but simultaneously erodes the biological machinery that supports vascular health long term. I want to be very clear, I'm not telling you to stop your medication without speaking to your physician. What I'm telling you is that this conversation deserves to happen, and you deserve to be the one who initiates it. Now, let me introduce you to a patient of mine. I'll call her Margaret. Margaret was 67 years old, a retired school principal from Ohio, sharp as a tack, deeply motivated about her health, and she came to me frustrated. She had been on lisinopril for 8 years. Her blood pressure was controlled, or hovering around 140/88, which, as her previous doctors had told her, was good enough for her age. But Margaret didn't feel good. She was exhausted by 2 in the afternoon. She had a persistent dry cough, a known side effect of ACE inhibitors that her former physician had minimized. She had cold feet, poor sleep, and a vague but persistent feeling that her body was running on empty. When I ordered a comprehensive micronutrient panel and a full hormonal workup alongside her cardiac evaluation, what I found was a woman whose magnesium levels were significantly below optimal, whose CoQ10 was in the lowest quartile for her age group, and whose cortisol rhythm was completely dysregulated. Margaret wasn't just hypertensive, her body was depleted, inflamed, and exhausted at a cellular level. And no blood pressure pill was going to fix that. This brings me to the first insight from the Chinese medicine model that I want you to understand. The concept of Shen, roughly translated as the body's foundational vital essence, and its relationship to what Chinese medicine calls ascending liver yang. In patients over 60 with hypertension, traditional Chinese physicians have described a pattern for thousands of years that maps remarkably well onto what we now understand as the neuroendocrine contribution to blood pressure dysregulation. When the body's yin, its cooling, nourishing, restorative energy, becomes depleted through decades of stress, poor sleep, processed foods, and emotional suppression, the yang energy, the activating, heating, pressure-generating force, rises unchecked. The result is what Chinese medicine calls liver yang rising, flushing, headaches, irritability, insomnia, and hypertension that is particularly reactive, spiking dramatically with stress, improving somewhat with rest. Sound familiar? A study from the Beijing University of Chinese Medicine, published in Evidence-Based Complementary and Alternative Medicine, found that patients diagnosed with the liver yang rising pattern of hypertension showed significantly greater response to herbal interventions targeting yin nourishment than to standardized antihypertensive treatment alone, with a 42% greater reduction in ambulatory blood pressure over a 12-week period. Now, the herbs used in that study, Tianma, Guting, and Xu Jueming, are not things I'm recommending you go and buy online without professional guidance. Herbal medicine is real medicine. It has real pharmacological effects and real interactions. What I'm sharing is the framework that nourishing the root, supporting the nervous system, restoring sleep architecture, reducing the neuroendocrine load that drives vascular constriction, produces a fundamentally different result than simply dampening the symptom. The second insight is about the role of the gut-heart axis in blood pressure regulation, something that Western cardiology has only recently begun to seriously investigate, and that Chinese medicine has been treating through diet for millennia. A landmark study published in Nature Medicine by researchers at the Cleveland Clinic demonstrated that short-chain fatty acids produced by gut bacteria directly regulate blood pressure through effects on the kidneys and peripheral vasculature. Patients with hypertension show consistently depleted populations of specific lactobacillus and bifidobacterium strains compared to normotensive controls. The gut, in other words, is not separate from your heart. It is a cardiovascular organ. Chinese medicine has always known this. The spleen-stomach network in Chinese medicine is understood to be the foundation of qi production, of energy, of the transformation of food into the substances that nourish every organ system in the body. When I see a hypertensive patient over 60 who also has bloating, irregular bowels, low energy after meals, and food sensitivities, I see a cardiovascular patient, because those two things are physiologically linked in ways that a blood pressure medication will never address. Here is what Margaret did over the following 6 months in partnership with her cardiologist, her physician of record, and myself as her integrative consultant. She began a targeted magnesium glycinate supplementation protocol, a form of magnesium that is particularly well absorbed and that has been shown in a meta-analysis in the journal Hypertension to reduce systolic blood pressure by an average of 5.6 millimeters of mercury in adults with documented deficiency. She worked with a licensed Chinese medicine practitioner on a dietary protocol, emphasizing specific foods with yin-nourishing properties: black sesame, mulberry, wolfberry, walnut, and properly prepared bone broth. She implemented a structured sleep hygiene protocol that her integrative team developed specifically around her cortisol dysregulation pattern, and she began a daily practice of Tai Chi, 30 minutes, 5 days a week. I want to give you the numbers because they matter. After 6 months, Margaret's resting blood pressure had dropped from 140/88 to 124/76. Her CoQ10 had normalized, her dry cough was gone, her afternoon energy was restored, and after a careful, monitored, physician-supervised reduction in her lisinopril dose, she is now on half her original dose, still under regular monitoring with blood pressure that is better controlled than it was on the full dose. I want to pause here, right in the middle of this video, and ask you something directly. How many of you watching right now have a blood pressure number that is controlled on paper, but you don't feel well? How many of you have been on the same medication for years without anyone asking why you developed hypertension in the first place? If that's you, you are not alone. And this conversation is exactly what I want to have with you. If you find this kind of integrated root cause thinking valuable, please give this video a like right now. It genuinely helps get this information to the people who need it most. And if you haven't subscribed to the Dr. Ming Chen channel yet, I want to invite you to join this community. Every week, I bring you this kind of rigorous, nuanced, clinically grounded information that takes your health seriously, not just your numbers. Now, the third insight: the extraordinary cardiovascular evidence behind 4 specific lifestyle interventions that Chinese medicine has championed for centuries, and that modern research has now quantified with remarkable precision. The first is Tai Chi. A systematic review published in the Journal of the American Heart Association, analyzing 28 randomized controlled trials involving over 2,000 participants, found that regular Tai Chi practice reduced systolic blood pressure by an average of 15.6 millimeters of mercury, a reduction comparable to or exceeding many first-line antihypertensive medications. Not a supplement, not a drug. Slow, intentional, meditative movement. The mechanism? Tai Chi profoundly downregulates sympathetic nervous system activity, the fight or flight system that in chronically stressed older adults is essentially stuck in the on position, driving persistent vascular constriction. The second intervention is acupuncture. I know that word makes some physicians in my profession deeply uncomfortable, but a study from UC Irvine published in Medical Acupuncture demonstrated that electroacupuncture at specific points, particularly Zusanli or ST36 and Neguan or PC6, reduced systolic blood pressure through documented modulation of opioid peptides and the rostroventrolateral medulla, a key brainstem center for cardiovascular regulation. This is not mysticism, this is neuroscience. The third lifestyle intervention with profound blood pressure implications is what Chinese medicine has always called cultivating stillness, and what modern medicine calls the relaxation response. Herbert Benson's foundational work at Harvard, confirmed by dozens of subsequent trials, demonstrated that a daily 20-minute practice of any form of deep relaxation, meditation, guided imagery, slow breathing, even gentle prayer, produces consistent, measurable reductions in blood pressure averaging 8 to 10 millimeters systolic in older adults. The fourth is dietary. The ancient Chinese emphasis on bitter melon, celery root, hawthorn berry, and danshan, also known as Salvia meteoriza. A meta-analysis in phytomedicine reviewed 23 clinical trials and found that danshan preparations produced significant reductions in blood pressure and improvements in arterial compliance, the elasticity of the blood vessel wall, in patients with mild to moderate hypertension. These are not folk remedies. They are pharmacologically active botanical medicines with documented mechanisms of action. Now, I want to be direct about something because I owe you my honest clinical perspective. There are patients for whom medication is not optional, at least not initially. If your blood pressure is 180 over 110, or if you have had a previous stroke or myocardial infarction, or if you have diabetic nephropathy, your medication is protecting your life right now, and any modification to it should happen only under close physician supervision. What I'm advocating for is not anti-medication. I'm advocating for a conversation, like with your doctor, with yourself, about whether medication alone is sufficient, whether the root causes of your hypertension are being addressed, and whether the biological cost of long-term pharmaceutical management is being acknowledged and mitigated. Let me tell you about one more patient. His name, for our purposes, is Robert, 72 years old, retired civil engineer from Atlanta. He came to me on 3 blood pressure medications simultaneously, amlodipine, losartan, and hydrochlorothiazide, and his pressure was still consistently around 150 over 92. His cardiologist was discussing adding a 4th agent. Robert was also experiencing significant fatigue, muscle cramping, and what he described as mental fog that had crept up on him over the past 2 years. When we did a comprehensive evaluation, we found that Robert had profound potassium and magnesium depletion from the hydrochlorothiazide, a diuretic that as a class is well known to cause electrolyte loss. He had subclinical hypothyroidism that had been missed, and he had a sleep apnea pattern that had never been formally evaluated, a condition that through its effects on nocturnal blood pressure surges is one of the most common and underdiagnosed drivers of treatment-resistant hypertension in older men. We addressed all 3 root causes. Robert no longer takes hydrochlorothiazide. His blood pressure on the remaining 2 medications at lower doses now runs consistently at 128 over 82. His energy is back, his mind is clear, and his cardiologist, to his great credit, is now a referral partner of mine. The 4th and final insight I want to leave you with today is perhaps the most important because it shifts the entire frame through which you see your health. Chinese medicine has a concept, 业精西方, which translates roughly as prevent illness before it arises, treat the root before the branch, nourish the body as the primary medicine, and use external medicine only as a last resort. This is not incompatible with modern cardiology. In fact, it is precisely what the best cardiologists in the world are now articulating through the language of lifestyle medicine, preventive cardiology, and precision health. The question I want you to carry forward from this video is not, what pill should I take? The question is, what is my body telling me? What root conditions are driving my blood pressure? And what is the most comprehensive, least harmful, most life-affirming strategy for addressing those root conditions? With medication playing its appropriate role, neither more nor less than that. Before I close, here is your action checklist, things you can begin discussing with your physician as early as this week. Number 1, ask your doctor for a comprehensive micronutrient panel, specifically checking magnesium, CoQ10, potassium, and zinc, particularly if you are on a diuretic or ACE inhibitor. Number 2, begin tracking your blood pressure at home at the same time each day, morning and evening, and bring that log to your next appointment. Patterns matter more than single readings. Number 3, evaluate your sleep. If you snore, if you wake frequently, if you wake unrefreshed, ask your physician about a sleep study to rule out sleep apnea, especially if your blood pressure is difficult to control. Number 4, commit to 30 minutes of moderate movement 5 days per week. The evidence for Tai Chi is exceptional, but walking, swimming, and yoga produce similar sympathetic downregulation. Number 5, reduce your dietary sodium to under 1500 milligrams per day and simultaneously increase your intake of potassium-rich whole foods, bananas, avocado, spinach, sweet potato. The sodium-potassium ratio is one of the strongest dietary predictors of blood pressure in older adults. Number 6, consider a formal consultation with a licensed integrative physician or a qualified practitioner of traditional Chinese medicine. Not to replace your cardiologist, but to complement that care with a root cause lens. Number 7, practice 10 minutes of slow diaphragmatic breathing every morning. Inhale for 4 counts, exhale for 6, every single morning. A reminder that everything I share here is general medical information for educational purposes. Please do not make any changes to your medications or your medical care without first consulting your own physician, who knows your full medical history. This video does not constitute medical advice, and no information here should replace the guidance of your personal health care provider. I want to close by saying something from the heart. If you have made it to this point in the video, you are someone who takes their health seriously, who refuses to simply accept a diagnosis and a prescription as the end of the conversation. That is exactly who this community exists for. The Dr. Ming Chen channel is built on the belief that you deserve full information, honest clinical perspective, and the kind of nuanced thinking that a 15-minute office visit can never provide. If this video gave you something valuable, a new question to ask, a new frame for understanding your health, a sense of possibility you didn't have an hour ago, please share it with someone you love who is managing their blood pressure. Give it a like. Leave a comment below telling me, what is your biggest frustration with how your blood pressure has been managed? I read every comment. This is a real conversation, and I will see you in the next video.